All right. Good afternoon, everyone, and welcome to our September State Advisory Council meeting. I'm Dr. Morgan Crossman, and I'm the Executive Director of Building Bright Futures. We are really excited to have everyone here today. Again, we're expecting over 70 participants for today's meeting for a range of reasons. The first is that we're having a regional spotlight where we will hear about some of the really incredible work happening in one of our regional councils as they are making progress towards their annual initiatives. We'll do very brief council business in terms of SAC roll call in a little bit, as well as voting on some minutes and past council activities. And then the bulk of today's presentation really is going to be looking at what the federal investment is coming through the American Families Plan, specifically around universal pre-kindergarten education. So we'll do a brief overview of that and have a couple of our partners who have participated in some conversations in the last 2 weeks give some of their perceptions about what we should expect. And then finally, and very exciting to most of us on the State Advisory Council, is this first look at the draft recommendations for the State Advisory Council for this upcoming year. So we are going to wait a few minutes until after we do the regional spotlight to do SAC business and introductions for everyone on the call. But I do want to take just 1 minute to remind everybody who hasn't necessarily been in these meetings, or if you have, about some of our working agreements. We really try and strive towards an inclusive space where we can honor all of the different experts in this room and hear about all of the different facets of this work. There are 2 or 3 of these working agreements that I want to call your attention to today as we're thinking through State Advisory Council recommendations and what's coming for the next year. And those 3 are to honor the complexity of this work and the fact that we as individuals do not know it all. So again, in thinking about all of the different components that make up our complex early childhood system, the purpose of having a State Advisory Council is to bring all of that expertise into one place and to be able to inform and advise. And because we do that, I also want to remind you to be thinking about how we as a group or as a unit are sharing responsibility for successes as we're moving forward towards this vision under our Vermont Early Childhood Action Plan, or what we call the VCAP. So I really appreciate everyone coming together today as a public-private partnership to move all of this work forward. And without further ado, I want to transition into our regional spotlight and have Beth give that introduction.
Thanks, Morgan. Very excited to have some regional partners here to talk about work that's happening in Addison County. So I'm Beth Trzanski. I'm the Deputy Director of Building Bright Futures. And as many of you know, BBF includes a network of 12 regional councils, which bring early childhood partners together to foster collaboration, share best practices, solicit input, and develop system efficiencies on complex and social systemic problems to ensure that children and families have access to high quality opportunities. We are excited to highlight the work of our regional council partners, which serve as the foundation for this whole network, including regional councils, VCAP committees, and here at the State Advisory Council. I believe it's important to hear from each other to build a stronger system and one way of communicating across the BBF network. So today we are joined by partners from the Addison Regional Council who developed the OK, You've Got This resilience campaign. And we are going to hear from them about this campaign to promote resilience in children and families. We have Emmy Harvey, who's a team leader at the Counseling Service of Addison County, and Darla Senecal, who's a regional manager with Building Bright Futures. And I'm going to hand this over to them. We have a practice at the State Advisory Council meetings to start with a mindful moment, and Emmy is going to lead that for us.
Thank you, Beth, and thank you for the warm welcome. Again, my name is Emmy Harvey. I'm a clinician and team leader at the Counseling Service at Addison County, and I've been part of the You Got This campaign. I'll tell you more about that in a bit, but this is one of the things that we did in our workshops. We led some mindfulness activities. So I'm going to lead one now. So go ahead and settle into your chair in a comfortable position. Close your eyes or take your gaze toward your lap. whatever's comfortable for you. Take a few deep breaths at your own pace, inhaling fully. And as you exhale, aim to relax your body into itself and the chair beneath you. Another deep breath or two to just settle in. And then breathe normally as you pick a place that you like to go, near or far, a place that you cherish, enjoy, and or feel at ease. Take a few moments to settle on a place. With a couple more deep breaths, imagine yourself there. You don't have to strain with the deep breaths, just mindful of those breath coming in and breath going out, and picture yourself in that treasured spot. For the next few moments, imagine what it might smell like there. See if you can bring that sensation right into your nose. And then in your imagination, look around. What are you seeing around you? Don't forget to breathe. What does the air around you feel like? The temperature? Is it still or is it breezy? Just savor the feeling on your skin. What might you hear there? Focus on how that sound moves through your ears, the impact it has on you. Settle in for a few more moments. Another deep breath. Inhaling and exhaling, and just take in that sensation of being there. And another deep breath. And then exhale. And then wiggle your fingers and toes a bit and come back to the room. Thank you for joining me in that. And then I'm going to turn it over to Darla for a few minutes.
Thank you, Emmy. So hi, everyone. Darla Senecal, Regional Manager for BBF. I cover Addison, Rutland, and now Bennington County as well. And today I'm going to talk you through our Okay, You've Got This project. So we can move on to the next slide. Thank you. So at the 2017 annual data meeting, for the first time, we had screening data from our local mental health agency and 2 of our 3 school districts that found that Addison County youth reported low on optimism, hope, and high anxiety. They correlated with youth risk behavior studies data that showed 1/3 of Addison County's high schoolers didn't feel like they mattered to the community. This bubbled up as a top priority for the region. We also had new access to screening data from significant population of Addison County's children. The YRBS and our health department data analyst had the new ability to crosswalk this data. It gave us a good picture of risk and protective factors associated with resiliency. We can go to the next slide. The decision was made to create a campaign for the region involving as many community partners as possible. Next slide. Resilience became the focus of our campaign. Next slide. There were multiple large group meetings held to gather input. We hosted smaller brown bag lunches and formed a steering committee to plan and lead the efforts. Next slide, please. Dr. Ginsburg's book on resilience in children and teens was used as a base for the resilience campaign. The 7 C's were determined a good way to engage the community. Next slide. This is our logo and tagline. The campaign was launched with a meeting of education, health, and human service providers. We had 75 people attend the meeting and asked them to think of the work they were doing or the work they could be doing to promote resiliency. We asked them to commit to ways they could promote, okay, you've got this. Everyone was given access to use the logo for co-branding, and they were also asked to host parent workshops. Next slide. We developed a website with parent resources. We've delivered dozens of workshops and presentations to childcare, schools, and other community settings. Emmy will talk you through the experience in leading parent workshops in just a moment. Some of the ways we engaged with the communities were a storytelling event with Sue Schmidt called Tales of Resilience. Movies on the Park in Bristol. We sponsored the film Inside Out and tabled at the event with resources for families and games. Held a De-Stress for the Holidays workshop with Dr. Jody Brakely. During COVID, we partnered with Rise Vermont to promote the Winter Passport and Dinners Together. We held a free virtual concert with Aeneas Mitchell called Songs of Resilience. Created YouTube videos promoting activities that help build resilience for families. And they were also shared on our Facebook page as well as our webpage. And local libraries created lists of books of showing resilience for both kids and parents. Next slide, thanks. There were also bookmarks handed out at local libraries and anywhere else we could put them, promoting the 7 C's. We had stress balls, tattoos were a big hit. The school nurse at Mary Hogan gave out stickers to kids who frequently had tummy aches and asked them to put them on their desk and read it every time they were feeling nervous. She reports that she sees fewer and fewer of these kids now that they have this resource. So we think it's working. There are many community partners still involved, even several years later. The early screening data was showing an uptick in resilience with youth in the area. And then there was COVID. We know from reports from partners that kids, caregivers, and families are all showing signs of stress. Regionally, data is currently being collected, and we hope to have hard data to show how we might be able to help going forward. How did we succeed? It was saturation and dose and the co-branding. Our logos appeared everywhere. By having so many community partners involved and the co-branding of, okay, you've got this message, the campaign was really widespread. And our last slide. And this is a slide of our website. So you can see the resources there. And now Emmy will talk to you about her experience and talk you through the parent workshops.
Thanks, Darla. So I'm going to talk about one little specific part of the resiliency project that we got going here at the Counseling Service of Addison County. Some of my colleagues and I gathered together. We were asked to create some parenting workshops based on Kenneth Ginsburg's book. And we decided to take a close look at the 7 C's and develop a little section, a session on each of the 7 C's. And what I'll just go over them again: competence, confidence, connection, control, character, contribution, and coping. So we created an interactive session on each to engage parents and caregivers in learning, problem solving, and planning how to integrate building and tending to these concepts into caring and raising their children. We tried to do it hands-on to get people really interested and engaged. We started with a pilot project in Virgins. They hosted it, provided the site for us. We did it for 4 sessions, 1 per week for a month. We invited parents and anyone from that community to come. We had a size limit, but I think we had about 7 for that first session. Notably, some of us were parents, all of us were clinicians and have worked with elementary age children for quite some time. While we were there, we set out to teach others about the importance of each of these 7 C's and how to help build and grow these qualities, skills, and actions in youth. We did this from the frame of "you've got this." So we weren't coming in as experts telling people what to do. One of our priorities was to help these small groups of parents, caregivers feel confident in what they're doing already. That's kind of the message, like, "You've got this, you can do it." And we wanted them also to feel capable and motivated to try some new things. Like I said, we worked to create a safe environment where they could share their experiences, frustrations, doubts, and questions. And it wasn't a counseling group, but people felt comfortable still bringing some of their challenges, which I think really added to the quality of it, because people felt very personal, like personally satisfied connecting with others, which happens to be one of the 7 C's, connection. So we also, as parents and people that work with kids for a long time, we were able to share, or willing to share, tales of our own challenges and foibles, working to normalize these challenges of being a parent and caregiver. So I wanted to just go over the key points of each of the 7 C's. And I don't want to linger too long, so I did just kind of a brief version. So competence. Our main message is, in order for kids to feel competent, we got to get out of the way and let them make some mistakes and learn to kind of ride the ups and downs. Confidence, we wanted to remind people to slack off with like, "Good job, you're great, way to go," on everything that their kid does, and instead give specific acknowledgement of what kids do well and how it benefits them, how to make meaning out of their positive efforts. Connection, time spent engaged with children is vital to them. And our big message was like, get your phone out of the equation and focus eye contact with your child, relate to your child, and get them off the screen as well. Control, we talked a lot about being a role model as a parent as being the most important thing. One of the most important things, like how you model self-control, is going to teach your kid how they can control themselves. Character, role model your values. Contribution, we really stressed that kids feel valuable when they contribute to others. For instance, helping others, doing nice things for others, doing chores. They help kids feel good, even though they're going to whine and complain about it the whole time. And I think, speaking of the pandemic, the contribution was a strong recommendation during the pandemic when people were feeling so isolated and helpless, really encouraging children and families to get out and do things for others as a way to balance out the anxiety and the other feelings, complicated, uncomfortable feelings all were having. And then the last of the 7 C's was coping. Again, we really stress that it's so important to take care of yourself as a parent, because a regulated adult is going to help regulate an unregulated child. We felt that parents, and we noticed that parents really were enthusiastic about this time they spent talking about these topics. We encouraged them to not think of it as rocket science. So I think that enabled parents to feel like, oh, I can go try this. I can do this. It's not that complicated. They also stated the importance of being in connection with other parents, sharing the challenges, and normalizing their challenges. And yeah, so incredible experience. We did a couple of virtual ones during the pandemic, and hope to get them going again in the near future. It was a rewarding experience as a provider as well. That's that. Darla, were you going to kind of wrap us up? There's another topic I know.
Yes, the one other piece we wanted to touch on was the scarcity of workforce right now, where we're seeing that across the board in many, many places, but especially in the mental health field. And while there were many opportunities for work at SAC, which is the Addison County mental health provider, currently they're in a pretty good position, but understand that that's not true for the rest of the state of Vermont. So we want to recognize the fact that we do understand that there is scarcity. And in a time when, as I said before, with COVID, we know that parents and caregivers and families are all feeling so stressed. And I know that that's another point that Beth and Morgan will touch on in their recommendations later.
Yeah. Thank you, Darla. I regret our director is out this week, so she could be more eloquent on this topic, but it's certainly been a stressful time as we see the want ads, employees needed everywhere. And we've certainly struggled this summer with long waiting lists, which is obviously there's so many people struggling with mental health, and we're really feeling a little bit better now, but we know that typically fall, the numbers will pick up again. And we'll hope that the staff that we have stay with us and that we don't have the vacancies that we had earlier in the year.
Great. Well, thank you, Emmy and Darla, so much for joining us and talking about some of the cool things that you're doing. It's, recognizing that regional councils come together and often identify, and we ask regional councils to identify kind of priority topics that they want to work on, and seeing how your council came together to work in partnership to really utilize existing resources or leverage what was available to be able to support kids and families in the ways that you saw were needed and were an existing gap is cool and inspiring. So thanks for joining and for leading our mindful moment. I really appreciate it. Yeah, great.
Yeah.
So that was our regional spotlight. It's great to hear what's happening. I am going to hand this over. We have some council business, just a little bit, and hand this over to our private co-chair of the State Advisory Council, Chloe Leary. Hey, Chloe, are you here?
I'm here. Can you hear me? Great. Hi, everybody. Nice to see you all and have so many people here today. And that was a great presentation. It's really great to hear about and inspiring. So thanks for sharing. So I'm going to do roll call, and I invite people who are not on the State Advisory Council to please put your name in the chat box, whether you're a parent of a little person in early childhood, if there's an organization you're representing, on how you interface with the network. Are you on a regional council? Are you on a PCAP committee, etc. So for those of you whose name I'm not going to say, if you would do that in the chat, that would be great. And I'm going to start with Cheryl Wilcox. Are you here?
I'm here. Good afternoon, everyone. Cheryl Wilcox with the Department of Mental Health.
Thank you. And Renee Kelly.
Good afternoon, everyone. Renee Kelly, Director of the Vermont Head Start Collaboration Office. Nice to see you all.
Miranda Gray.
Hi, everyone. Miranda Gray, Interim Deputy Commissioner for the Child Development Division.
Ken Jones. Ken, are you with us? Okay. Kate Rogers.
Hi, everyone. Kate Rogers, Agency of Education.
Hey, Kate. Wendy Trafton. Wendy, are you here? Can't see everybody at once. So, Elisa Stahlberg or Janet Kilburn. Either one. Okay. Jessica Brumstead.
I'm here. Hi, everyone. Representative from Shelburne and St. George.
And Allie Richards.
Hi, everyone. Allie Richards, Let's Grow Kids.
And hey, Janet Kilburn's here for VDH as well. Sorry, couldn't get unmuted.
Thank you. Emily Merrill.
Yes, hi, I'm here. Emily Merrill, parent representative.
Amy Johnson.
Hi, everyone. Amy Johnson, Parent Child Center of NCSS, representing the Vermont Parent Child Center Network.
Christy Swenson.
Morning, everyone. I'm here representing Head Start.
Flora Diaz-Smith.
Hey, good afternoon, everybody. I'm here representing Vermont School Boards Association. It's nice to see you.
Alexis Duquette. Lexi. Ashley Miller.
Hi, everyone. This is Ashley Miller. I'm a pediatrician at the South Royalton Health Center.
Becca Webb.
I am. I just couldn't find the off mute. Hi, everybody. I'm 6:30 and early childhood special educator.
Eddie Gale.
Hi, Eddie Gale with the A.D. Anderson Foundation.
Mike McRae. And Paul Dragon.
Hi, everybody. Paul Dragon. I'm the Executive Director of the Champlain Valley Office of Economic Opportunity. Good to see everybody.
And Kendall Smith, are you with us? Did I get everybody on the, okay, great. Awesome. And again, I'm Chloe Leary. I'm at the Winston Prouty Center in Brattleboro, and I am the private co-chair, along with Cheryl as our public co-chair. So I should have said that too. So, all right, I'm going to hand it back to Beth.
Thank you. I think our next step is that we are thrilled that we have a number of new staff members here on the Building Bright Futures team. So I just want to give a call out. We are so psyched to have Ali Jang, who joined our team about a month ago, serving as the regional manager for Chittenden and Franklin Grand Isle. So Ali is not on the call today. He's off today, but if you're in that region and have not connected with him, please do. And he brings a wealth of experience around family engagement and engaging particularly New American communities. So we have Ali Jang, and then we also have Allison Oscar. Allison's on our call, so she can wave. Allison comes to us with a range of work in both for-profit and nonprofit organizations, and she's serving as our new finance manager. Welcome to our team, Allison. And third is Anna Brulette, who joins our team as the policy and program director. So Allison can wave. We are thrilled for Anna to join our team, bringing national policy expertise, particularly in the early childhood arena, with a background in data and research as well. So welcome, Anna. And now I'm going to hand the baton to Cheryl, who's going to do some minutes for us.
So this is for our State Advisory Council members looking to do approval of our May and July State Advisory Council minutes. So if folks either want to put it in the chat or unmute, I'm looking for a motion to accept the May 24th meeting minutes.
So moved. Floor.
Thank you. Thank you, Floor. Can I have a second?
Ali.
Thank you, Ali. All those in favor?
Aye.
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 Right. Anyone opposed? Would anyone like to abstain? All right. It sounded overwhelmingly like the ayes have it. Becca, I see your hand up and it just popped up. So I want to make sure I know. No, all set. Okay. Just want to make sure. Sometimes the squares move and I don't want to be missing anything. So we're all set for May. Can I have a motion to accept the July 6th meeting minutes, please?
This is Chloe. I'll move that we accept July 6 minutes.
Thank you, Chloe. Can I have a second?
I'll second. Floor.
Thank you, Floor. All right. So all those in favor?
Aye.
say aye.
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 All right, anyone who's opposed? Anyone who would like to abstain? Great. So it sounds like, again, we had resounding in favor. So it looks like those are approved as well. Thank you. I'm going to pass this back to Morgan.
Awesome. Thank you. And thank you to all of our State Advisory Council members who are here. I want folks to bear with me for 30 seconds. I'm going to go off script because I want to make sure that everybody is on the lookout for what's coming next in terms of Vermont's childcare and early childhood education systems analysis. So again, for all of our State Advisory Council members, our community partners, over the course of the next few months, we will be looking to you all through the State Advisory Council meetings, our Vermont Early Childhood Action Plan meetings, and our regional council meetings to be having really hard conversations about the current status of our early childhood system and how we want to move that forward. It's really timely to be thinking about that, especially today as we're talking about potential federal investment that might come into the state of Vermont, and as we're thinking about making a series of recommendations to all of us, but also to our decision makers across the state. So I just want to very briefly give a shout out to Elliot, who's here with us from Foresight Law and Policy. So Elliot is one of our national partners that we have tasked with supporting us with this systems analysis. So just wanting to give Elliot a quick opportunity to jump on and say hi to everyone so you know his face.
Thanks, Morgan. I'll just very quickly say hello, and we're just getting started, and I'm getting oriented, reading through a lot of interesting documents about Vermont's early childhood system, and I hope I'll have a chance to speak directly to many of you and collectively to all of you at some point in the future. So if you have any questions, please be in touch with Morgan and or me, and we'll look forward to talking to you again soon.
Thanks, Elliot, and thank you for being here today to observe the State Advisory Council in action and to kind of hear about our current priorities and what we're planning to move forward. So again, thank you to all of you, and we will be in touch with exactly how you can participate in providing information to our national contractors and throughout the process as we think about how we best move forward our early childhood system. So next, we're going to talk about the Universal Pre-Kindergarten education component of the American Families Plan. And, you know, I think what I'd like for folks to be thinking about is our ultimate vision for Vermont's kids and families through the Vermont Early Childhood Action Plan. And I participated alongside Jessica Brumstead, our representative, and Kendall Smith Friday at the Hunt Institute's Early Childhood Leadership Summit. And we were really there to serve as liaisons for Vermont. And there was so much discussion around early childhood governance, administration, revisioning our systems, thinking about building supportive systems, thinking critically about equity, childcare, pre-K, and how to build this integrated system. And I wanted to pull two quotes from that meeting that really are serving as our vision and how we should be thinking about some of this work. So the first is, when you're trying to change the system, be bold. Do not be afraid to fail. You need to hold the vision, set the strategy, set expectations, name outcomes, and be committed to getting it done. Don't provide a window of opportunity for people to question whether it can be done. It can be done, it should be done, and that's what's most important in making progress and outcomes. The second quote is that we are looking at a once in a century type of federal investment to transform the system for early learning and education. This is a time to be bold, and we need to pay attention to the science and communities to move towards a system that meets the need of each and every child. Really powerful and inspiring quotes from leaders across the country who are really paying attention to what is coming through the American Families Plan. So what I want to do today is remind folks about the vision through Vermont's Early Childhood Action Plan and using that as our guide to leverage this investment to build the system that we really want to see. So I'm going to have Beth or Dora put the link in the chat bar to the current draft of the American Families Plan bill, solely for those of you who want to dive into the weeds like I did. to see where they talk about childcare, where they talk about pre-kindergarten education. And just so that folks know, today we're not going to be talking about the childcare section, but for reference, that starts on page 188. So today, I want you to know that what we've been doing is prompting all of Vermont's leaders to be really thinking critically about how the pieces of this bill are working together to build a strong system. How do we think about childcare, universal pre-kindergarten education, and all of the other components of our system to be supporting kids and families in a meaningful way and building an integrated system. So what I want to walk you through really quickly is an overview of what is currently proposed under Universal PreK within this reconciliation bill. And the caveat here is we know this bill is going to change, right? So right now it's still in the House and we are waiting to see what this looks like. And it's in Congress. I say House and Senate because we're talking about Vermont, but it's in Congress and it will eventually move. And we're hearing that it can move as soon as the end of this week. So as it currently stands, it's asking for free universal pre-K for all 3 and 4-year-olds, prioritizing the needs of underserved children. And when we say underserved children in the bill, it's talking about children experiencing homelessness, children in foster care or kinship care, children and families who are engaged in migrant or seasonal agriculture labor, children with disabilities, and dual language learners. It also calls for each state to be able to define what children, underserved children are and how you're thinking about need and supporting each and every child. The goal of this pre-K section is that families would be saving on average about $13,000 a year. It would require that universal pre-K delivery is universal, high quality, free, and inclusive. And very critical for us to know in the state of Vermont is that it's requiring people to build and improve on the mixed delivery model. So we already have a mixed delivery model in Vermont, which is so exciting. And it's talking about the importance of family childcare, Head Start programs, schools, and childcare centers. There's a really strong component of this focusing on parent choice and actually meeting the needs of kids and families and thinking about how we as a state give voice to families. Another key component that folks need to know about is that it is a state-federal partnership for cost sharing. So there will be a state match required. This is something we're really prompting our leaders to be thinking about. One exciting component of this bill, and I'm looking virtually at Renee Kelly and Christy Swenson, is a really strong partnership with Head Start. So they are really seeing Head Start programs as a gold standard, as a beautiful model for how we serve underserved kids and families, and to think about how we are partnering and giving voice to families. Another key component of this bill is how we focus on improving transitions. So for me, when we say transitions, we're obviously talking about the transition from early intervention to special education, but also from pre-K to kindergarten, transitions from public and private programs. Matt Levin, I'm seeing your note in the chat and I will definitely address that. There's also a really strong emphasis on collaboration with the entities who are carrying out programs under Part C of IDEA. So in Vermont, early intervention and Part C fall within the Child Development Division, and we really think about how we're providing comprehensive services, but there's a very strong component of how we support children with disabilities and special healthcare needs. And the last thing I want to mention about the overall view or picture of this is the partnership with higher education institutions and thinking about how we're facilitating workforce and degree attainment. So some of the questions that are coming up, not just in the chat, but that we've started to ask each other and our leadership is, what do we mean? How do we define universal pre-K? What does that actually mean? In the bill, it outlines that it means it's universally available to all children in the state without any additional eligibility criteria, specifically thinking about high quality, free, inclusive, mixed delivery for high need communities. The big question that we are all still asking is what does it mean in terms of dosage or number of hours? What does it mean in terms of annual hours? It sets a note in a section about Head Start and how we model after Head Start, but there are also some additional questions there around what it means and what's required as we think around, about the dosage. When we think about the funding, and Matt, this gets to your question, this program is seen as an entitlement program. So it's going to be on a 10-year funding cycle. Right now, in fiscal years 22 through 24, the feds will cover 100% of states' expenditures for pre-K services, and then it decreases 10% every consecutive year through 2028. And so this would need to be reauthorized, similar to other entitlement programs. In terms of other pieces of funding, it currently includes 50% of states' expenditures for administering the program, but then a state match is required. So right now, we're really trying to dive in and find out what can contribute to the state match and how much of that will be necessary over time. And even more than that, what will Vermont be okay with accepting responsibility for over the next 10 years as we're thinking about the match requirements for this? So what does the existing program look like? How are we thinking about the funding for it? How are we looking at the pre-K component paired with the childcare component? Where do our existing dollars live and are they allocated as we think about match? So right now, Matt, we have not seen a specific percent, although there are specific categories in the section on the finances. I can get you the exact page number for where it talks about the match and what we're looking to see. But the match is something that our state decision makers are actively talking about right now. For state advisory council members and community partners, I think one thing I want to draw a line from to this bill in the VCAP is that we have all committed to less transitions for kids. We've committed to equitable access to services for kids and families. We've committed already to a mixed delivery model and reducing the burden for families in terms of cost. We've committed to highly qualified workforce in our VCAP. And I also want to make sure that folks know that Vermont is so well positioned to execute this funding that could come from this administration in thinking about having a true universal pre-K offering. We already do that for 3 and 4-year-olds 10 hours a week. So how do we look at the existing system and figure out how we build? So what I really want folks to know as I wrap up this section and open the floor to a couple of our partners who had just discussed this with some of us over the course of the last 2 weeks is that we're really pushing our state agency leaders, the governor's team, to ask the right questions. How do we build on the existing system? How do we leverage the federal investment? And we, over the course of the next couple of weeks, are compiling all of this feedback, all of this information for our state agency leaders to be able to provide feedback to our congressional delegates and actually impact how this bill moves forward. So I want to pause for just a second, and I'm looking specifically at Becca Webb, Allie Richards, and a couple of others who have been involved in discussions around this bill in the last couple of weeks specific to pre-K to see if there's anything that I may have missed that you want to bring to this table.
As usual, Morgan, I just think you did a fantastic job summarizing it. It's no small matter. I think we need, there's so many unknowns right now. We'll know soon in the next couple of weeks, fingers crossed, that will really, change a lot of these dynamics. I think we should all stay really closely tuned. Again, thank you, Morgan. What a great role for BBF to keep us sort of up to date and waving the flag about how important this is. This could seriously, affect our planning, affect the interaction with H171 here in Vermont. So, it could be big money, it could be big policy direction. It's all in line with what we've all been talking about for years and years and years. It's such a beautiful, position to be in, I think, here in Vermont, where we've been building consensus together through many, strategies. But so I think it's all very positive, but I think there's just a lot of unknowns and we need to grapple with those. So this education is just really helpful for us all here together. Thank you.
Thanks, Allie. Becca, did you want to weigh in?
I think just echoing, I think, there's a lot, and I encourage people to delve into at least the universal pre-K stuff that's in the actual bill. But I think we're asking the right questions, which is really the point that we're at right now.
Thanks, Becca. So for those of you who are going to dive in and read this bill, again, we are in the process of documenting questions, data that's still needed, and thinking about, what does it actually mean to administer universal pre-K? What does it cost? What is our capacity? What is the need? And as you're coming up with questions that are either logistical questions about how we would be able to use that funding or programmatic questions, please send those to us and we'll make sure that we're using those questions and any information about the current status of pre-K in our system and providing that to agency leaders, the governor's team, and our congressional delegates. All right. Thank you for allowing us to take the time during this meeting. I think it's really important that we're all on the same page and that we have a cohesive, united vision for how to execute this work. And we're lucky because in the state of Vermont, we do have the VCAP as that guiding vision right now. So I'm going to turn it back over to Beth Trzanski to move us into the policy recommendations component of today's meeting.
Thanks, Morgan. So the next piece is around policy recommendations. Now, we are really invested in how to strengthen the voice of the State Advisory Council, and the policy recommendations are a tool that we use to engage, to listen to what the identified gaps and needs are and to be able to articulate those. We have been working on this over the last couple of months, and so what we're presenting to you today is really a synthesis of what we've been hearing. You know, the leaders, the State Advisory Council are leaders chosen as a primary advisory body to the governor and legislature on all things early childhood. And a part of this role is formal recommendation, being able to make formal recommendations. So this is an annual process, and we recognize that up until this point, we've been making recommendations annually, and we are really looking towards in the future being able to be more nimble in making recommendations to respond to more urgent needs. So trying to be able to identify how to do that with this existing body. As we work to finalize recommendations for the 2021-22 year, it's important to pause and think about this moment to create meaningful change, especially as we consider, you know, what we've just heard around federal investments that may be on the horizon that we look forward to. It is a really exciting moment. And I think it's also really great today to be thinking about work that we're doing regionally, work and policy that we're developing at the state level, as well as considering how to inform federal policy, as well as how that might impact us. So it's really a unique place to be. So what we will be presenting to you are draft policy recommendations that have been built with input from all different levels of the BBF network. These were identified both at regional council tables, at VCAP committee meetings, brought to the VCAP summit in July, as well as other kind of BBF network gatherings. We really seek to capture policy recommendations that identify the current needs and gaps in policy, are actionable in the current year, and are measurable, and move us toward a more equitable early childhood system. You will note that in these recommendations, in certain situations, we're calling out areas where there are barriers that need a strategy to reach resolution as a step towards policy change. So that is something that you will observe. Today, we're presenting the recommendations for feedback to make them stronger or affirmation that they hit the mark. We will not be taking a vote today, just as a matter of process. So you'll have time, if this is the first time, kind of reading them and digesting them, to do your own review for State Advisory Council members, as well as provide input if you're a community partner. The recommendations will be presented in their final state. We send them out in advance of the October meeting and then take a vote at the October meeting, and then finally printed in the State of Vermont's Children Report, which is published and distributed in January, and then shared with policymakers. So that is briefly the process. So what we are planning to do today is we want you to consider during today's review what I want to just share briefly with you. I do have a few slides that I'm going to pull up. Each policy recommendation includes kind of what level of change is needed, so that you may have seen this image that we've used quite a bit with the Vermont Early Childhood Action Plan. We strive to have a family and child centered system, and recognize to do that, sometimes change needs to happen at different levels. So in the policy recommendations and what was sent out ahead of time, and we'll put the link in the chat as well, it notes if something is a policy recommendation that impacts level 1 and 2, children and families. Level 3 is the community level, including the services and opportunities that families engage, including home, neighborhood, doctor, school, etc. So those community-based settings. Or level 4, meaning the Vermont's policy and system. So those are noted. This is what I demonstrates the different levels that we have engaged to be able to build these policy recommendations. So of course, always starting with evidence and data to inform our decision-making and policy development. Some of those reports that we're using, early childhood needs assessment was completed in the last year. We have the Vermont Early Childhood Action Plan data dashboard, certainly several reports that were published as part of the preschool development grant, as well as others. We also are looking towards the 12 regional councils and the key priorities that each council identifies. That helps us understand what those emerging needs are. The VCAP committees, there are 6 active VCAP committees that meet monthly and have identified issues and kind of communicated where those gaps and needs are. This is where we are right now, which is State Advisory Council review, and then endorsement, eventually moving towards publication and education of policymakers to decision makers. So that is briefly our process. So what we're going to do is we are actually going to break into 2 groups. We found that there's quite a bit here to present. And so to do this, we feel like in a digestible chunk, we are going to break into 2 groups, and you'll be able to identify which group you want to go into. But essentially the 5 different themes of policy recommendations. The first is respond to Vermont's mental health crisis, talking about community-based mental health opportunities and workforce needs. The second one is address chronic inequities in Vermont's early childhood system, talking about what we observe as how the system and programs could be better resourced to be able to support kids in early care and education settings. The third is elevate families as decision makers, opportunities for family leadership, engagement, culture shift in terms of how we engage families and elevate their voice. Recommendation 4, the theme is develop a well-resourced early care and education system. So talking about changes at all different levels from the program up through the system and financing, including workforce of the early care and education system. And 5 is evolve the early childhood data system and infrastructure. Morgan, is there anything you wanted to add in there before I talk about breaking into small groups?
The only thing I want to add is that as we're talking through these recommendations, one of the things that you might not see or hear in these buckets as clearly specified is the workforce crisis for childcare. It's something that we've all been committed to and have been working on. It does fall within one of the sub buckets, but we really saw this as an opportunity to highlight some of the other areas of need, specifically mental health. But you will see, I believe, in chronic inequities and develop a well-resourced early care and education system, a note of, don't forget, we have to be addressing the childcare workforce crisis, but that it isn't its own bucket or recommendation section in and of itself this year, given the fact that we are prioritizing a lot of this childcare workforce crisis through H171 and through the upcoming systems analysis. And then the only other thing I would say is, again, what we really want you to be thinking about as you're reviewing these recommendations is there something glaringly missing? As we think about these buckets, as we think about this next year for kids and families and in our early childhood system, what's the next step? This is what we have pulled together as what we see and have heard from you all as a critical next step. And the question is there anything glaringly missing from that? The other thing I'd like you to be thinking about is how you, in your own personal life and in your professional hat, will use these recommendations for the coming year, recognizing that we will vote on them in October, and then they'll be printed in the State of Vermont's Young Children and Families.
Thank you. All right. So time is of the essence. We are going to give you the opportunity to provide, to explore 2 or 3 of these recommendations. We will look at them, read them together. You'll have a chance to give us some input. Again, this is not the last time you can provide input, but this is, we feel like, a better use of our time to be able to get your input in some smaller groups. So essentially group 1 will look at the first 3 recommendations. Group 2 will look at the second 2. So I'll give you a chance to look at those themes. And then ask Ellen, who's managing our Zoom rooms, to open up the small groups, and you'll be able to choose with Zoom which group you want to go to. There's no wrong answer here. So wherever you land is totally okay. And we will spend about 15-20 minutes in those small groups. All right, if you have questions, feel free to hang back. Otherwise, feel free to open those rooms, Ellen, and we will see you all in a bit.
To do what we just did in small groups was a very brief snapshot in our group of only one section of the recommendations, because there was so much great discussion about what we should be thinking about, nuanced language, and how we prioritize, because we as a state advisory council in true fashion have so many ideas for how to improve Vermont's early childhood system. And this was this year's best best opportunity to say, how do we make change in these 5 buckets? What's the next step, or what are the next 5 steps? So what I want you to be really thinking about in this next couple of weeks is where we've missed something, how we prioritize what's here, and how you as community members and state advisory council members are going to use this information, because it's a lot. You are not all going to walk into a legislative testimony and present on all of these like I have to, and not be boring. Really challenging, right? So how do you make these things exciting? How do you make sure that you are promoting the vision and the passion behind some of this? So our questions to you all, and I'd like to ask our state advisory council members to hold their feedback, because we know we will get it from each of you, but I'd like to ask our community partners, is there anything that you heard in the last couple of minutes that really resonated with you? It lit a spark that you're excited to see in these state advisory council recommendations for this year?
So I was in the first group. I really thought the part about engaging families and getting family participation was really important. We work with families here. I'm down at Bennington County Head Start, and to see the difference it makes with them, and how much it goes into how proud they are of their child's education really says a lot about including parents and with our community. So I'll be really excited to see how that works out.
Thank you so much, April.
Morgan, I was excited to see the recommendation on finally getting some funding to execute the finance study in Act 45. I think that could really inform the financing work as a companion, as you note here, to the ECSA. So I think it would be exciting to get that work done.
Thanks, Reba. Others?
I've been thinking about equity, and we use the language equity of access in a number of places in the document. And I've transitioned to using the language equity of access, supports, and quality, because children deserve not only to be able to access the programs, but then the ability to participate in those programs with inclusive supports.
Thanks, Meg. Great feedback. Any others before we open the floor for the SAC members?
Morgan, this is Cynthia, and I would just say I am so hopeful that we really do realize an integrated data system that is shareable back out to the communities. I'm just so excited to see this, and I really hope that this is it, that we arrive.
Thank you, Cynthia. And I don't know if the other group made it all the way through your recommendations. We did not, but one of the last was really around data integration and how we are executing this data-informed vision for Vermont's early childhood system. Any SAC members want to say, I am so thrilled about X?
I'll jump in. I'm really thrilled about the monitoring piece, Morgan. I mean, so again, like one of my comments about prioritization, I was thinking more about, you asked, what do you mean by that? One is maybe a little bit of like who's on first sometimes. And for BBF, again, there's like, this is a comprehensive thing of all that we need to do together for a strong early childhood ecosystem. Great. And how can we support really a realistic path to get it all done? I think monitoring, the effectiveness of programs and the ARPA dollars and all the things that are in here and watchdogging, the dates and that the new, IT system that's coming out of the state. All of these are really hugely important components that underlie the rest of the system. And I feel like, again, BBF, it's been a huge gap. The BBF has the expertise and it's the appropriate sort of role for BBF to play, and it can sort of help us all understand how to direct funds, how to help prioritize, how to sort of put this on a realistic path. So to me, it's in so much of this. It's such a great role for BBF, and it helps me be hopeful that this is realistic because it kind of lays the foundation for a lot of it.
Thanks, Ali. One more SAC member. Anything you're super excited about?
I'm a little biased, but I really appreciate the focus on early childhood mental health, and that's something that's been a priority for a while and that it hasn't gone by the wayside. This is something that, as somebody who works at a PCC that's also a DA, we have an influx of referrals that are impossible to meet right now. And so that investment in that system of care, as well as the investment in the workforce that supports those families, is so needed. And I just really appreciate that that is a priority that we're continuing to focus on.
Thank you, Amy. So I know that you all got to hear a little bit more and dive into a discussion about half of the recommendations, right? So now what I'm asking you to take away is that 4 to 6 page sheet of all the SAC recs, and I want you to look at what you didn't hear about today as well, and really be thinking about what might be missing and how we can take that next step in this year. We will be taking feedback for about another week and a half on State Advisory Council recommendations, and then we will be providing the final voting recommendations at the October State Advisory Council for adoption on behalf of our SAC members. So thank you for pulling up that slide. We do want to call your attention to a new initiative that we have just stood up this year. Traditionally, at our October meeting, we brought together some of our regional council partners and leaders alongside the State Advisory Council. But what we've really committed to this year is prioritizing and promoting the work of our regional councils, our regional council network, our leaders and our regional managers, and providing them a really concrete opportunity to come together with each other to celebrate the unique contributions of each of those regional councils, to be sharing information across the state about what's working, the challenges, but also some unique regional innovations, to be focusing on how we best support kids and families in the different parts of the state. And so that this group alongside our State Advisory Council really are seeing and utilizing regional councils as the critical foundation for building bright futures, as the group that are identifying the needs, barriers, and challenges of kids on the ground and being that advisory body right at the base of this network and supporting all of our initiatives throughout the state of Vermont. So really excited to be hosting this Regional Council Summit Wednesday, December 1st. Really hoping for strong attendance and for folks to be able to attend and hear what is happening across the state of Vermont, just like we heard at the beginning with our regional highlights. So thank you all for being here at today's meeting. We are thrilled to have you. We are anticipating quite a bit of feedback and excitement of our State Advisory Council recommendations. And again, I want you to think about what it means in this moment to be prioritizing the needs of kids and families, to be thinking about how we leverage federal investment, and what is the next step in whatever you care about for kids and families. What's the next step that has to be accomplished this year to make progress in that area? All right. Thank you all for being here. Have a great rest of your Monday.